Very often I'm asked by parents, how could I have diagnosed my child's congenital heart defect earlier? So I think today I'm going to be spending some time on that. So if you have a child who is very irritable, unable to feed well, who has recurrent chest infections, is not gaining weight properly, or is not a normal pink in color in the sense that the child is dusky or bluish. In all of these instances, you should suspect that the child may have a congenital heart defect and should reach out to a pediatric cardiologist. What the pediatric cardiologist will do is examine the child. He will probably auscultate where he might hear a murmur, and then he will advise certain tests. The common one is an ECG and an X-ray chest. These will, to a large extent, help in narrowing down the diagnosis. The mainstay for diagnosis of a congenital heart defect in today's time and age is going to be an echocardiography. It's a non-invasive test. What it will tell you all about the structure of the heart. It'll tell you about the functioning of the valves. It'll tell you about the arrangement of the various segments of the heart. And if there are any narrowings, any holes, any obstructions, and the function of the heart can also be ascertained by doing an echocardiography. So I would say that in about 90% of the times you would go ahead for surgery based on echo. Sometimes you need additional information, which could be in the form of structure. So there we would do a CT angiography. At other times you may need hemodynamic data, and thereby I mean pressures within the heart, for which a cardiac catheterization is needed. Once all these tests are done, generally in 100% of the cases you have a diagnosis, and the surgical planning or management can be done subsequent to this.